Our next speaker is Dr. Kenneth Brandt. I know he's well known to some of you who trained under a county, a resident at the University of Illinois, and then at Boston University, and then a fellow in Boston University in rheumatology under Alan Cohen. He also then was a research fellow at the Kennedy Institute in London, and he did a postdoc, and he was on the faculty of Boston University through professor, and then left Boston and went to Indianapolis, where he was professor and head of rheumatology at Indiana University. He also became professor of orthopedic surgery, and he is presently clinical professor at Kansas University and adjunct professor at NYU. He's got numerous invited lectures and awards. This year I've decided to limit the introductions to like 3 slides. He's won the Carl Nachman Prize. He's won an award from the ACR. His work on doxycycline in osteoarthritis was one of the most significant advances in rheumatology in 2004, and he won an award from the Osteoarthritis Research Society International. As far as that's not true. I got 4 slides for Dr. Brandt. As far as this Osteoarthritis Research Society International, this is actually all late work that he's doing just in the last few years. He's on the Treatment Guidelines Committee. He's on the Organizing Committee for a workshop on consensus in osteoarthritis imaging. He's on the Task Force for Definition of Radiologic Progression of Knee and Hip Osteoarthritis. And he's chairman of the Working Group on Defining the Disease State through the FDA. And he's going to talk today about the chondroprotective drugs for osteoarthritis. Are we looking under the wrong lamppost? Dr. Brandt.
Well, I really appreciate the invitation to have a chance to speak with you today. It's a privilege. It's an honor. And I was here, a number of years ago. And this thing has certainly grown. Thank you for the very kind introduction. Sounds like an obituary. I don't think I need to explain looking under the wrong lamppost. There are a couple of people in the audience who were former fellows of mine at Indiana. And I need to start with an apology, because everything I said about osteoarthritis then was wrong.